Everything you ever want, it's everything you ever need, and it's here in front of you.
Presented on the screen are the contents of our discussion for today. First is definition, followed by fundamental components of evidence-based practices, steps on evidence-based practices, importance of building evidence-based practices, utilization of evidence-based health practices, benefits of evidence-based health practices, tips for implementing evidence-based practices, and lastly are the references.
Evidence-based practices is the integration of best research evidence with clinical expertise and patient values, which when applied by practitioner will ultimately lead to improved patient outcomes.
Let's move on to the three fundamental components of evidence-based practices. In the original model, there are three fundamental components of evidence-based practices. First, the best evidence, which is usually found in clinically relevant research that is being conducted using sound methodology. Second, the clinical expertise refers to the clinician's cumulative education, experience, and clinical skills. The third is the patient values, which are the unique preferences, concerns, and expectations each patient brings to the clinical encounter. It is the integration of these three components that defines a clinical decision evidence-based. This integration can be effectively achieved by carrying out the 5 following steps of evidence-based practice. As we continue, as can you see the Venn diagram, it shows the evidence-based practices can be taught as a coming from the 3 different sources. First, the individual clinical expertise. It refers to the implicit and explicit knowledge about physical therapeutic diagnosis, treatment, prevention, and prognosis that gains from cumulative years of caring for patients with disease and injury, and working to improve and refine that care. And the second one is the best external evidence. It refers to the systematic reviews, randomized controlled trials, best practice, and clinical practice guidelines that supports a change in a clinical practice. The last is the patient values and expectations. The patient and his or her caregivers create the most important pillar of evidence in the decision-making process. Evidence from the patient can be divided into 2 categories: the values and expectations. Patient values involves and includes the beliefs, preferences, expectations, and cultural identifications that the patient brings to the therapy environment. Fundamentally, values are the core principle that guides a person's life and life choices.
These are the 5 steps of evidence-based practice. First, formulate an answerable question. One of the fundamental skills required for EBP is the asking of well-built clinical questions. By formulating an answerable question to focus your efforts specifically on what matters. These questions are usually triggered by patient encounters, which generate questions about the diagnosis, therapy, prognosis, or etiology. Second, find the best available evidence. The second step is to find the relevant evidence. This step involves identifying search terms which will be found in your carefully constructed question from step 1. Selecting resources in which to perform your search as PubMed and Cochrane Library, and formulating an effective search strategy using a combination of mesh terms and limitations of the results. Third, appraise the evidence. It is important to be skilled in critical appraisal so that you can further filter out studies that may seem interesting but are weak. Use a simple critical appraisal method that will answer these questions. What question did the study address? Were the methods valid? What are the results? How do the results apply to your practice? Fourth, implement the evidence. Individual clinical decisions can then be made by combining the best available evidence with your clinical expertise and your patient's values. These clinical decisions should then be implemented into your practice, which can then be justified as evidence-based. Fifth, evaluate the outcome. The final step in the process is to evaluate the effectiveness and efficacy of your decision in direct relation to your patient. Was the application of the new information effective? Should this new information continue to be applied to practice? How could any of the 5 processes involved in the clinical decision-making process be improved the next time a question is asked?
Next, the 5 As. These steps may be more memorable if remembered as the 5 As: ask, acquire, appraise, apply, assess. In the figure of 5 As, EBP process. First, ask. A question arises during care of a patient. Second, acquire. Completely articulate all parts of the question. Third, appraise. Conduct a thorough focus, search, and select the highest quality evidence. Fourth, apply. Evaluate the evidence for validity and clinical applicability. Fifth, assess. Use clinical expertise to integrate applicable evidence with attention patient values. Next, examples of EBP in nursing practice. First, infection control. When seeking medical care at a hospital, the last thing a patient wants is to contract a hospital-acquired infection. By following to evidence-based infection control practices, nurses play a significant role in preventing sickness before it occurs. This includes maintaining a clean hospital environment, wearing protective gear, utilizing barrier precautions, and performing proper hand washing. Although nurses have numerous responsibilities, the time spent on infection control is well worth the effort.
Oxygen usage in COPD patients. While administering oxygen to COPD patients, it is crucial that nurses adhere to evidence-based nursing practice for the health and safety of their patients. COPD patients should be administered oxygen despite the assumption held by some that doing so can result in major complications such as hypercarbia, acidosis, and even death. This can prevent hypoxia and organ failure. Providing COPD patient with oxygen, which is the evidence-based treatment of choice, can improve their quality of life and help them live longer.
Examples of evidence-based in nursing practice. Non-invasive blood pressure measurement in children. Accurate blood pressure measurements are crucial for effective therapy. Hence, nurses should adhere to evidence-based practice when measuring blood pressure. Children's blood pressure is measured differently than adult blood pressure. The auscultatory method is used to assess the blood pressure of children, which is then compared to data obtained using the oscillometric approach. Size of the intravenous catheter and blood administration. When utilizing intravenous catheters to deliver blood for packed red blood cells transfusions, nurses should adhere to EBP or PRBC. The protocol instructs nurses to use a catheter with a lower gauge, which promotes patient comfort.
Importance of building an evidence-based practices. First, it uses science and research. EBP methods mostly consist of supported scientific theories of medicine, meaning healthcare professionals can provide their patients with the most informed and reliable treatments. Healthcare professionals also derive EBP procedures through majority agreement in the scientific industry, which helps them create innovative and advanced care options validated by extensive scientific research and studies. Second, it allows for continual evolution of treatment. The understanding of effective healthcare is constantly evolving through scientific research. As a result, EBP treatment may also improve and evolve based on new evidence. Third, it addresses patient needs and preferences. Although scientific validation and research typically make up EBP treatments, patient needs and preferences are also important for implementing these treatments. Considering specific needs helps healthcare professionals provide customized treatment plans to patients and promote empowerment and self-advocacy within patients. Lastly, it promotes optimal treatments. Combining clinical experience, patient preferences, and scientifically proven practices, EBP ensures that patients get best possible care for their peculiar healthcare needs and situations. In addition, EBP practices ensure patients receive the most updated and recent care possible.
Indeed, nurses have the skills to communicate with patients and evoke their feelings. Therefore, it is important to integrate their knowledge and skills into care. Patient preferences and values relate to the patient's perspectives, beliefs, expectations, and goals for health and life that influence decision making. All of these must be weighed against the evidence. Patients may choose one treatment over another based on comfort, cost, convenience, or other beliefs. Therefore, it is important to listen to their opinions and inform medical decision making. EBP is used as a professional practice approach in a variety of professions, but is rapidly increasing in the field of nursing. The patient may raise doubts about treatment options available in regard to their religious, spiritual, socio-cultural values, including economical issues.
These practices, and lastly are the references. Now let's move on to the benefits of evidence-based health practices. First, it keeps healthcare professionals up to date. Due to technological advancement, there are discoveries in the medical field. Researchers also conduct more studies on diseases and treatment methods. As a result, it's important for healthcare professionals to stay updated and learn about recent developments. Developing evidence-based practices requires research that may help healthcare professionals study and learn about different protocols for various situations. Next, it improves the decision-making process. Comprehensive research helps healthcare professionals make more informed decisions regarding a situation. In addition, the evidence-based practice method requires these professionals to find relevant information, analyze them, and derive the best approach to produce the desired outcome. As a result, better decision-making helps improve the healthcare professional's confidence and ensure patients receive the best care possible. Next, it increases patient recovery. Combining clinical expertise and experience with extensive research ensures that the healthcare professionals find the most effective treatment techniques. For instance, nurses may research a patient's symptoms and discover effective treatment methods for that condition. Discovering tested treatment methods can help patients get better diagnosis and precise treatments, which may help them recover quickly. Next, understands the risk of treatments. Researching previous cases of a condition and the patient's symptoms can help healthcare professionals find potential outcomes and implement preventive measures when treating their patient. For instance, healthcare professionals can learn the side effects by researching the medicine. Then, they can use this information to find alternative treatment plans for patients who the side effects may affect.
EBP gives patients a role in planning the care. EBP methods include patients when making treatment plans. Healthcare professionals may talk to patients, ask their opinions, and allow them to make decisions about their treatment. Allowing patients to participate in their treatment procedure can help them feel more confident and provide some level of independence. In addition, it may help patients advocate for themselves in instances that the professional may have missed. Next, EBP promotes the quality, efficacy, and cost-effectiveness of psychotherapeutic interventions and reduces the likelihood of harm. Evidence-based psychotherapies are associated with greater quality and accountability as well as higher levels of public health and well-being. EBP enables practitioners to avoid treatments of little or questionable effectiveness, thereby saving time, money, and resources.
Benefits of evidence-based health practices. EBP leads to the generation of new knowledge. EBP fosters lifelong learning and critical thinking among practitioners. EBP minimizes the use of potentially harmful therapies that have been shown to have harmful effects on patients, and increases practitioner awareness of possible adverse effects of treatment. Evidence-based psychotherapies are associated with greater quality and accountability, as well as higher levels of public health and well-being. EBP's emphasis on the use of multiple information sources, rigorous outcome evaluation, and progress monitoring measures provides a useful framework but critical thinking.
Benefits of evidence-based health practices. EBPs focus on informed consent and the consideration of clients' unique experiences and preferences increases the likelihood of client engagement and collaboration, which are key predictors of positive treatment outcomes. EBP promotes positive treatment outcomes by emphasizing shared decision-making between practitioners and clients, prioritizing the needs of patients. Although evidence-based nursing relies on research, it also considers the desires of individual patients. Since one of the main tenets of nursing is focusing on the patient's needs, evidence-based practice helps you continue to improve patient outcomes while weighing the preferences and experiences of each patient.
Tips for implementing evidence-based practices. First, identify and organize resources for your research. You might find it useful to have access to databases, books, and other sources for study. You can cut down on the time spent looking for and confirming proof sources by having quick access to pertinent sites. Also, it could be advantageous for senior co-workers to mentor younger professionals and impart their knowledge and experience to them. Second, establish patient-focused goals. To guarantee that you design specialized treatment plans for particular conditions, it can be advantageous to create goals that focus on the patients. Also, it aids in the identification and treatment of illnesses more effectively. It's a good idea to do individual case studies while creating an EBP for your patients. Also, you might need to discuss patient-focused goals with the patient so that they feel more involved in their care.
Number 3. They provide education and training. In order to expose personnel to a variety of patient situations and treatment options, several hospitals and healthcare facilities may offer staff training exercises and educational courses. They might study and comprehend their responsibilities within the medical team through these programs. Also, it might promote staff collaboration, which might promote evidence-based practice.
Never be afraid to try something new, because life gets boring when you stay within the limits of what you already know. This is Group 4, signing off. Go live your life and play your own role in your greatest show.
Everything you want is right in front of you, and you see it